S.p.A was developed as a dermoreconstructant. This is the product popularly called Skin Booster. It was developed as a metabolic stimulator, moisturizers for the treatment of the tired-looking skin, the first sign of aging for the skin which requires revitalization, but also for the treatment of all the different types of scarring, stretch marks, post-acne scarring, post-surgical scarring, as it brings a total reconstruction of the skin. Comes to ingredients in S.p.A, hyaluronic acid, two different molecular weights, 0.5 megadalton and 1 megadalton, 20 milligrams in 1 milliliter, succinic acid, amino acids. Succinic acid in the product is one of the most interesting active ingredients. Succinic acid is naturally occurring in our body, and it's produced in the main vital organ. If it comes to the action of the succinic acid, it activates succinate receptors in the organs in the skin during the hypoxia, which is the lack of oxygen in the organ. We have used this reaction in order to produce a similar response in the skin while applying S.p.A containing 1.6% of succinic acid. Succinic acid works directly on the mitochondria, has direct impact on the mitochondria. It increases cellular metabolism, it increases cellular communication. It will have a revitalizing effect on the skin. It will also have a very good effect on angiogenesis, so it's creation of the new capillaries, of the new vessels. That's why this product is perfect to be used for rosacea skins, for the open capillaries, but also for the treatments of scars and stretch marks when we need to rejuvenate the skin, when we need to redermalize the skin, when we need to make sure that the new capillaries are overgrowing the new tissue in order to redermalize it. Succinic acid will have also moisturizing effect on the skin. It is a product used in prevention of allergic reaction occurrence, therefore it's used very often in the medicine. So this product would be suitable for the patients, for the clients who experience negative effects of with other products. S.p.A is safe for sensitive, sensitized skin to be used as the dermoreconstructant. Another ingredients are, of course, amino acids. As we know, amino acids are building blocks of every single cell, so the product is going to revitalize the skin, it's going to rebuild the skin. One of the most interesting amino acids for me is glutamic acid, which S.p.A contains. It stabilizes the pH of the skin, which is very important if it comes to redermalization, if it comes to the treatment of different skin conditions, such as, for example, rosacea, or for the patients with sensitive skin. High and low molecular weight hyaluronic acid, so those two substances complete the whole pool of substances used in this dermoreconstructant. They will provide moisture in the skin, they will provide the scaffold for the collagen. So we have the full range of condition which will allow us to obtain absolutely phenomenal results as we are providing complete reconstruction and redermalization. If it comes to the frequency and the procedure, we are recommending the procedure every 2 to 4 weeks, depending on the patient needs. We need to remember that the more mature the skin is, the more damaged the skin is, the frequency needs to be further apart. So for mature patient, I would leave 3 weeks between the treatments, even 4 weeks, depending on the condition. Please always refer to the specific condition of your patient, to the specific skin condition. Treatment areas is the face and body. When you're treating the eye area, and it's a phenomenal product for the treatment of the eye area, because also of the succinic acid. Succinic acid is increasing the lymph influx, so for the swollen, accumulated lymph around the eye area, this is going to be the best product to go for. You need to remember that if you're using off-label protocol, if you're using procedure around the eye area, we would recommend dilution of the product 1:1 with the saline, because of the content of the very high content of the hyaluronic acid. We need to remember hyaluronic acid is going to attract the water, so we don't want to cause more puffiness. That's why dilution is recommended for the treatment around the eye area. We would normally use 2 milliliters per treatment on the face. Around the eye area, if we're just treating the eye area, half of the milliliter around each eye area. eye area is not only underneath the eye. Please don't forget to treat the upper eyelid just under the eyebrow, but also we need to support ligaments, so we're treating just above the eye on the forehead. That will give us the best results, the best possible outcomes for the treatment. For the body or for the rest of the face, we do not dilute the product. We're using product as it is from the bottle without any dilution. 2 milliliters for the face, 2 milliliters for the neck, I use 3 milliliters, 2 to 3 milliliters for the décolleté area. If you're treating face, neck and décolleté, you can use the whole vial. That should be an appropriate amount for the treatment.